తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
How to prevent and treat brain hemorrhage. Brain hemorrhage is a severe medical condition that occurs when a blood vessel in the brain ruptures and bleeds into the surrounding brain tissue. It can cause symptoms such as severe headaches, weakness, numbness, vision problems, confusion, and loss of consciousness. It can also lead to complications such as brain damage, stroke, coma, or death. Brain hemorrhage is a medical emergency that requires immediate treatment. The treatment depends on the cause, location, and extent of the bleeding. The main treatment goals are to stop the bleeding, reduce the pressure in the skull, and prevent further damage to the brain. This blog will discuss brain hemorrhage's causes, symptoms, and complications and how to seek timely medical attention. We will also share our expertise and experience in providing the best brain hemorrhage treatment in Andhra Pradesh at Dr. Rao's Hospital. Causes of brain hemorrhage. High blood pressure is the most common risk factor for brain hemorrhage. High blood pressure can weaken the walls of the blood vessels in the brain and make them more prone to rupture. Head trauma or injury. This can occur due to accidents, falls, violence, or sports. Cerebral aneurysm. This is a bulge or weakness in a blood vessel in the brain that can burst and bleed. Aneurysms can be congenital or acquired due to aging, smoking, or other conditions. Blood vessel anomalies. These are abnormal formations of blood vessels in the brain that can leak or rupture. Examples are arteriovenous malformations, AVMs, and cavernous angiomas. Blood or bleeding disorders. These are conditions that affect the ability of the blood to clot normally. Examples are hemophilia, sickle cell anemia, and leukemia. Brain tumor. This can compress or invade the blood vessels in the brain and cause them to bleed. Consumption of illicit drugs. Some drugs, such as cocaine, amphetamines, and heroin, can increase blood pressure and damage the blood vessels in the brain. Symptoms of brain hemorrhage. The symptoms of brain hemorrhage depend on the location and size of the bleeding. Sudden, severe headache, vomiting, problems with vision, swallowing problems, confusion or difficulty understanding, difficulty speaking or slurred speech. Loss of balance or coordination, seizures, drowsiness or loss of consciousness. Complications of brain hemorrhage. A brain hemorrhage can cause serious complications such as brain damage. The bleeding can deprive the brain cells of oxygen and nutrients, leading to their death. This can permanently impair cognitive, motor, sensory, or emotional functions. Stroke. The bleeding can block the blood flow to other brain parts, causing a stroke. A stroke can cause paralysis, speech problems, vision loss, or memory loss. Coma. The bleeding can increase the pressure in the skull and compress the brain stem, which controls vital functions such as breathing and heart rate. Hydrocephalus. The bleeding can interfere with the drainage of cerebrospinal fluid, CSF, which cushions and protects the brain. Diagnosis of brain hemorrhage. If you suspect that you or someone else has a brain hemorrhage, call 9010056444 immediately and seek medical attention at Dr. Rao's Hospital 1. The diagnosis of brain hemorrhage involves a physical examination. The doctor will check your vital signs, neurological status, and medical history. Imaging tests. The doctor will order tests such as computed tomography, CORT, scan 2 or magnetic resonance imaging, MRI, to confirm the presence and location of bleeding in the brain. Blood tests. The doctor will order tests such as complete blood count, CBC, prothrombin time, PT, international normalized ratio, INR, and liver function tests, LFT, to check for any underlying conditions that may cause or worsen bleeding in the brain. Treatment of brain hemorrhage. The treatment of brain hemorrhage depends on several factors, such as the cause and type of bleeding, the location and size of bleeding, the extent of brain damage, the overall health and age of the patient. The treatment options may include medications. The doctor may prescribe painkillers, corticosteroids, or osmotic to reduce swelling and pressure in the brain. The doctor may also prescribe anticonvulsants to prevent or control seizures or antibiotics to prevent or treat infections. Surgery. The doctor may perform surgery to stop the bleeding, remove the blood clot, or relieve the pressure in the skull. The type of surgery depends on the cause and location of the bleeding. A craniotomy is a procedure where the surgeon opens the skull and clips or repairs the ruptured blood vessel. Endoscopic surgery is when the surgeon inserts a thin tube with a camera and light, endoscope, through a small hole in the skull and drains or removes the blood clot. Stereotactic radiosurgery. This is a procedure where the surgeon uses a focused beam of radiation to shrink or destroy the abnormal blood vessel. Rehabilitation. The doctor may refer the patient to a rehabilitation program to help restore the lost or impaired functions due to brain damage. The rehabilitation program may involve physical therapy, occupational therapy, speech therapy, cognitive therapy, or psychological counseling. Prevention of brain hemorrhage. The best way to prevent brain hemorrhage is to control the risk factors that can cause it. Treat high blood pressure. High blood pressure is the most common risk factor for brain hemorrhage. Avoid head trauma or injury. You should wear a seatbelt when driving and a helmet when riding a motorcycle, bicycle, or skateboard. You should also avoid contact sports or activities that can cause a head injury. If you suffer a head injury, you should seek medical attention immediately. Investigate corrective surgery. If you have a cerebral aneurysm, AVM, or cavernous angioma, you should consult your doctor about the possibility of corrective surgery to prevent them from rupturing and bleeding. Be careful with anticoagulant drugs. If you take anticoagulant drugs like warfarin, Coumadin, follow your doctor's instructions carefully and monitor your blood tests regularly. Eat a healthy diet. You should include foods that improve your heart and brain health, such as fruits, vegetables, whole grains, lean proteins, nuts, seeds, and fish. You should also limit your intake of salt, sugar, saturated fats, trans fats, and cholesterol. Conclusion. Brain hemorrhage is a severe medical condition that requires immediate treatment. If you experience any symptoms of brain hemorrhage, you should call 901-005-6444 immediately and seek medical attention at Dr. Rao's Hospital 1. Dr. Rao's Hospital is one of the best neurosurgery hospitals in India that offers comprehensive and advanced treatment for brain hemorrhage and other neurological disorders. Dr. Rao's Hospital has a team of expert neurosurgeons led by Dr. Mohana Rao Pattabandla, one of India's best neurosurgeons. Dr. Rao's Hospital also has state-of-the-art equipment and facilities that enable them to perform minimally invasive neurosurgery accurately and precisely. If you want to know more about brain hemorrhage prevention and treatment, you can visit our website or contact us through our email info@drraoshospitals.com. We will happily answer your queries and provide you with the best possible care. Please share it with your friends and family who may benefit from it. Dr. Rao's Hospital, your trusted partner in neurology and neurosurgery.